Hi, welcome back to the Millennials for Myo podcast. Thanks for joining us. So, today we're going to be discussing what happens when adults go untreated for any various of the concerns that we've discussed before. So, things such as, if they have a tongue tie that they haven't dealt with or revisited, or they have incorrect oral rest posture, what that looks like from when they've had it, likely as a kid, and how it impacts them as an adult. So, again, one of the biggest things is in relation to sleep. So, sleep apnea is something that can develop, as early as childhood, as we remember from our last episode, if you were listening. If, for example, they have a tongue tie and when they have a tongue tie, it's restricted in their mouth. So, most times, like if it's severe, like it's tied right to the floor of the mouth, there's also a varying degree of how tongue ties can present and how it impacts people. But ultimately, if the tongue is restricted, it's less likely to be able to fit up and reach up into the roof of the mouth, into the palate for correct rest posture. And so if the tongue has weaker muscles due to, part of the issue is being tied and not working the muscles that need to be worked every day, then, when people are sleeping, when adults sleep, then their tongue could slide back into the airway. And as we remember, this can lead to issues in snoring and sleep disordered breathing, because if the tongue is sliding back and blocking that airway, then it's going to jolt people awake to sort of, I know you're going to have to.
I guess a lot of people don't really know what the diagnosis is for sleep apnea. For the most point, it's obstructive sleep apnea, or OSA, is if you see it just written shorthand. And now there's new apneas showing up. And so one of the biggest one that, Marley, it's it hits home for me because
Yeah.
I probably present with many of the issues. And that is the young fit female apnea. And this usually presents in a more younger female, obviously, as well as she's just generally fit. She doesn't have a very large neck circumference. There's not regular signs, as well as her sleep apnea test comes back negative for sleep apnea. As well as she averages 95% oxygen levels, which if I was monitoring that with any kind of sedation patient or anything like that, like we do workups in our office for any kind of sedation, kids or adults. And 95% is a very regular reading, and it's actually a great reading. And so this specific version of sleep apnea is caused by respiratory effort related arousals, and it was previously thought to be a precursor to obstructive sleep apnea, but is now seen to be its own independent condition and actually is now being treated on its own aside from the obstructive sleep apnea. And one of the biggest things that I see as a hygienist or within our clinic is a narrow, high arched palate, a long face, a narrow chin, as well as usually a TMJ click or TMJ issues, maybe some clenching or grinding issues. Usually, some of the medical complaints would be cold extremities, cold fingers, toes, someone who has some high anxiety, maybe some depression issues. They're not getting a restful sleep. They're waking up a lot of the times through the nights. Many headaches, migraines. IBS is one of the odd signs of not getting your regular sleep. And we've previously talked about how breathing and your pelvic health all kind of connects together. And so naturally, IBS is just an easy one to connect there. And it is treated similar to obstructive sleep apnea, but can be improved with the reduction of alcohol consumption or sedative medications before bedtime. Lots of anxiety or depression medications are sedatives. And so sometimes we're treating the symptoms and not always the issue at hand. These things have been cited from Area Sleep Company. I love the way that they've been looking into this and kind of thinking about it in a different sense. And I have my own personal kind of theory on why this has all happened generationally or within our own kind of millennial crew of people. And personally, I found for myself it's all due to some kind of self conscious behavior. I spent, oh, what was it, like 13, 14 years in school, but, between like
Yeah.
elementary, high school, middle school, and college. And then that whole time I was so conscious about how my tummy looked while I was sitting in class that I would sit there with
Hmm.
my abs literally engaged and I started chest breathing. And I didn't realize it until I was sitting in my initial myofunctional course and I was like, "Wait. I totally do that and I do it out of total self-conscious behavior." And I wonder if, other people have this learned behavior or maybe I'm just crazy.
You are, but also,
I
yes, I
mean,
agree.
we're sitting here talking about like
We
what,
all have a
facial
little bit.
muscles casually at like 8 o'clock in the
Yeah.
morning.
Yeah. And so I thought this was so interesting because obviously we talked a little bit about this before we're doing this podcast because I found the same thing. And with like the push in, the world and the culture to like look a certain way and like fit into a certain size or like whatever. It's like as soon as you said this to me, I was like, that is so interesting. So it goes to show you that like it's not just, overweight people struggle with breathing and sleep apnea. It's like literally you can look healthy
Yes.
on the outside. But again, if you're not using the right muscles, if you're not breathing the right way, whether you're larger or smaller, it could happen to anybody. And it's just how you use your muscles to function. So I found the same thing whenever you said that. I was like, "Oh my God, my whole life, my core has been engaged because I'm just like, why?" Like now I'm like, "Oh my God, like what have I done?"
I catch myself doing it still and I'm like, "Oh, Hales, stop."
And you actually stop breathing. Like sometimes you can get so engaged that I'm like, and I noticed that too. I'm like, "Oh my God, I'm not breathing for like a minute. This is not good."
And my teeth are clenched and my face hurts.
Yeah, yeah. So then it just like, goes to show you that you want to be breathing properly. And if you are constantly engaging your core, then you are going to be chest breathing because you're not allowing that diaphragm to, inhale, exhale, and come out and come in like it should. It's a muscle, just like everything else, right? So it's something that should be happening.
Yeah. Utilizing that piston maneuver.
Yeah. Yeah. And so again, like not just in sleep, but breathing when you're sleeping and breathing during the daytime. If you're not doing it properly, like it can lead to serious issues. So like, like you could be fatigued like all day, no matter how much sleep you get or how much you think you're breathing. There's an efficient way of breathing and there's an inefficient way of breathing. And regardless, it can lead to you feeling just mental fog and just like all of these and like a little
Yes.
bit anxious too. And then just like because you're hyperventilating yourself in some cases, right? So it's just like it can really take a toll on your health and your sleep and your overall well-being.
Do you notice like with yourself,
Hmm.
I notice that I'll like sometimes sigh just in regular everyday life, just like like whoa.
Yeah, yeah, same. And like literally, even before we started this, remember, I was like, I feel like I can't, people who feel like they can't catch their breath. So I'm totally one of those people. And I'm like, I feel like I have to yawn to like, okay, like now I can speak because you're always like, you're kind of like, you're not consistently breathing. There might be a pause in breathing, then you have to like
Reset.
what's the word? Like kind of recharge, yeah, reset yourself, reset your breathing. So that's what's happening to some people who like they have to have a big sigh because when you sigh, you get more oxygen to places where it needs to get, and then you can fully like, continue on.
It's
But
funny that it
yeah,
all
I'm a yawner.
totally comes back to your oral rest posture. Here we are again.
Hmm.
Where's
Yeah,
your tongue?
yeah,
And can you actually be able to breathe with the way that you're postured?
yes. And so again, another factor that, in untreated adults, if the tongue is low, there's a like most likely they are mouth breathing, although it is, if they can have their lips apart, they might be nasal breathing. But anyways, for the most part, majority of people who have their tongue low, their lips are apart, their mouth breathing. And as we remember from last time, like one of our other episodes is like leads to cavities, it can lead to sinus issues. And then also, if your mouth is open, you're more likely to have a head forward posture as well. And so if your head is forward, in normal, like every day, if you have a head forward rest posture, it's going to throw off your alignment in your whole body.
Restrict your airway. So, as we're talking about this, kind of a section of people who get frequent nosebleeds. And it kind of just seems like, I don't know, when you're talking about it, people who get them regularly, they're like, oh, got a nosebleed today. Took me like 20 minutes to clear it up. Just happened. I wonder if there's a connection there with the mouth breathing and then your nasals. It's not getting the same airflow, the same tunnel version that you need to keep your anatomy
Yeah.
proper.
I think that there is a link there, and I have to do a bit more digging, but I mean, I had a patient ask me like, anyways, so he used to have nosebleeds. I think he's 11 years old. And the dad asked me like, is it related to mouth breathing? I'm like, it could be. Anyways, he's progressed along in treatment, and so he's getting better with resting his tongue up and keeping his lips closed. And so one day I just generally asked, I'm like when was the last time you had a nosebleed? Like, how's that going? And he's like,
Mm-hmm.
I don't remember.
Oh,
So it's been a
good.
while. And I was like, huh. So there is something there. Yeah.
There is a connection there, just.
Yeah.
Hmm.
Yeah.
That's
Interesting.
intriguing.
And then, yeah. So talking more about a little bit more posture. So, and I bet you know a little bit more about this too, but just in terms of the dental occlusion and the dental bite, um,
Well, in the dental world, you have full like facial profiles.
mhm.
And so anyone who's ever had like orthodontics done, you get all of these weird photos taken. And we have you hold these metal things in your mouths and move your lips in funny ways, or we stand you up against the
Yeah. Oh, we
wall.
have
And
fun with it too. Yeah.
the last time I did pictures on a patient, I literally think she thought I was crazy.
Really.
I was like measuring her face and like taking pictures, and she's like, "Why are you doing this?" And I'm like, "Because when you come back and I take them again, you're going to be shocked. Just please hold this measuring tape so I can take these pictures."
Yes. I know you should see my iPhone camera just like scrolling. I'm like, people be like, what are you doing? I swear it's for work. And they're like,
I was looking through when we were doing the exercises and recording them.
Yeah.
And I was looking through them all to try and find the waggle spot exercise because you know how bad I am at it. And I was trying to show it to a patient, and I was having a bad day and I could not make it happen. And so I was like looking through, and she looks over and she's like, "Do you actually have that many photos of literally just tongues?" And I'm like, "Well, at least it's like mostly my tongue."
Yeah, exactly.
But that is something that like totally we're monitoring, and that orthodontists especially, they would be more so the people to talk to about that. And we're going to interview one of my personal favorite orthodontists later.
Nice.
And he will kind of go into a little bit more on how the facial profile can restrict your airway and how it all happens. But again, we want to go right back to when we're catching things at these little kiddos' ages, and we're fixing them, and we're fixing the musculature and the way that they function so that these incorrect jaw relationships just don't ever have to happen.
Yeah. I was just,
And that's just really our goal and our basis. So in relation to poor posture, one of the big things that we would see in the jaw relationship is an underbite. People usually lean more backwards if they have an underbite. So in those pictures that I was talking about earlier, you can kind of even see it when their mouth is closed from the side profile, as well as if someone has an overbite, their head usually will be more leaned forward and they'll have more of a head forward posture. But these improper jaw relationships, or this improper kind of neck posture, can lead to a lot of chronic neck, back, and shoulder pain in adults. And lots of times we're treating those signs and symptoms just because, oh, I'm getting old, my back hurts, this, that, the other thing. I have chronic pain. Like,
Yeah. I think like
I get it.
I think it's
I have chronic pain.
the mentality, right? Like at some
Yes.
point the mentality has shifted and it's not always for the better. But like you said, like this is why like, oh, like, my back hurts, my neck, like let me go to the chiropractor and get an adjustment. Okay, fair enough. Like, and I'm like chiropractors can be super helpful for sure. But if you're finding that you have to go every week or every other week, it's like, okay, again, like my brain goes to what's the underlying thing? Are you getting
Why is
adjusted?
this
Yeah.
causing?
And then like
Is it an acute issue?
and then throughout the whole week, if your head goes right back to that posture or your jaw relationship is not corrected, of course you have to keep going back to the chiropractor because you're not aligned and you're not doing anything to help you be aligned. And it's like, I see, that's the difference of you see like 60-year-old people,
Mm-hmm.
and there's the ones who work out, they go for walks or even runs and they're lifting and their pain is minimal. Well, it's like
Absolutely
that
minimal,
person is
yeah.
taking care of their muscles. They're doing their best to breathe and to stretch and all that stuff. The people who don't, then that's, where you see differences in aging and differences in pain severity and just things like that. So if you take care of the muscles, then you're preventing again them consistent soreness as you get older.
And one of the big thing that we see obviously in the dental world is TMJ pain, TMD issues.
Hmm.
And so popping, clicking of the jaw joint, constant. So I think 80-90% of the population clenches, grinds of some sort or
Hmm.
some version. Um, Incorrect oral rest posture, even sometimes when I'm treating adults as seniors and we're taking those pictures just as a new patient profile, or if we're doing, sometimes we'll be doing 3D scans for some reason, maybe a crown, a bridge, anything like that. And it'll pick up even their tongue when it goes to show you the 3D image. And you can see their tongue kind of pushing through where they have teeth missing or anything like that. And their tongue sits right at the bottom of their mouth. And I hadn't really ever thought about one and two going together. But then when you see this incorrect oral rest posture, I've started looking into their medical histories
Hmm.
and trying to follow up. Do they have kind of chronic health issues? Do they have chronic pain? Do they have chronic headaches? All of those things. And I ask these very specific questions. And I even got a comment yesterday that was like, I wasn't asked these questions the last time I came in. And I was like, okay,
Hmm.
I know, but here is why.
Yeah.
This is something new to the area. It's something new that I've learned about. And here are the risk factors. Here are the things that we may be able to prevent if this is happening. Here are some stretches. Let's just see if they help.
Yeah. For sure. And I think those scans, I love to look at them as well because they can really tell you so much. And sometimes the people, again, awareness is key, usually the first step in a lot of treatment. But yeah, like I know somebody I know somebody who was like, I'm teaching these things too.
Mm-hmm.
And they're like, oh yeah, no, like my tongue's up. Yeah, I can feel it. But just like chronic sinus issues. And so I sent him to go get one of these CBCT scans,
Mm-hmm.
and I saw like a little itty bitty space like up in the roof, and I like it's a close friend, and I was just like, liar, like you said your tongue
Liar.
was up, and I see here that like so you think that you're feeling a certain thing until you
Mm-hmm.
like have the hard evidence and you're like, oh well, I thought I was, but this is showing something
Mm-hmm.
completely different. And it's like, I remember back to like this kid I had. I think I mentioned it in like one of our other episodes where it's like the youngest TMJ kiddo. Like I've never had a
Oh
kid.
yeah,
He's
yeah,
like 8. And so he just like again, like in chronic ear infections and stuff like that. So his rest posture was um upper teeth on the lower lip. And what's that
yeah.
like what that was doing to him is or what it would do to anybody as they do it more and more is like would set back the lower jaw.
Mm-hmm.
And so it's like no surprise that, like, again, incorrect rest posture. This was starting for him at such a young age. Sometimes it takes people longer, but it just
Mm-hmm.
goes back to like treat the people young, prevent it so that you don't end up with TMJ issues because it is painful. Like
Yes.
it's
And
bad.
that's like only with that kid specifically, one of the things that I would be concerned about because I have a very special place in my heart for oral cancer. I've known quite a few people who have been affected by it.
Mm-hmm.
And any kind of chronic trauma to like lips or cheeks, like cheek biting, lip biting, it can change the development of those cells
Oh,
and can cause some damage within the tissues and can cause differentiation in the cells themselves. And so that's another thing that we don't think about that comes with TMJ issues because sometimes we're sucking those cheeks in as we're clenching and grinding and we're chewing on them without even knowing. Or because our jaw is sore, we're kind of letting it loose and then we're chewing on our lip or this or that just because we don't want our teeth to clench when we're at rest.
yes. Yeah, that's interesting.
But that's just something that like I've noticed with the TMJ things. You usually see soft tissue signs as well.
Yeah, there's so many different perspectives like this. I didn't realize that, and now that's something that's going to be on my radar as well. And then yeah, like if you're clenching or grinding your teeth, like not only what does it do to your teeth, it's going to wear down that enamel, but then it leads to like again, like pain in the TMJ, like that joint, and it could, if it's bad, like it leads to popping, clicking, they can't open their jaw or their jaw shifts when it closes, and it's just like it's such a delicate little area that is just like some people don't think about. And then again, more misuse of your jaw. Like I share this with some patients, but not right off the bat because I don't want to like terrify them, but it is a real thing, is
Mm-hmm.
like trigeminal neuralgia. So that's your trigeminal nerve that has three branches. And so one goes right to the jaw, like right to the mandible. And so it's like years and years and years of
Yeah.
mismovements, inappropriate movements is can lead to serious nerve damage. And so it's not something to
Yeah.
even like take lightly, but I share this with people because I'm like, fix yourself
Well, and
now, like
trigeminal
please, like
neuralgia has
it's not worth it
it's
because
such
it's
a
irreversible.
wide variety. Some people get numbness, some people get tingling, and other
Yeah.
people get severe pain.
It can be shooting pains, like
Excruciating pain.
shooting, stabbing pains. And it's like, it's the only cure is like,
Mhm.
pain management. So there is
That's the
no
same
really
with
cure, or go for surgery.
Mhm.
And the surgery is brain surgery because you have to go into that cranial nerve. And like, that's not for everyone, especially if it's been years and they're like 80 years old now and they have trigeminal neuralgia. So, um, it's something that is seriously like
Obviously
you
we
need to
have
prevent that for
some
sure.
serious feelings about TMJ. And so
I'm like yelling.
so our whole next episode is going to be on, you guessed it, TMJ.
Yes. So this was like a shallow little dive into like, oh my God, please do help
Look,
yourself and think about these things and prevent it. But we're gonna go into like,
dive right into
some
it,
sort
tell
of
you what it is,
uh
how it develops, how it presents, what signs and symptoms you can look out for, what nerves specifically can be affected within TMD issues. So thanks for hanging out with us. We hope to have our coffee with you again and look forward to seeing you in our next podcast.
yeah, goodbye from your millennials for Mayo.